Hello, everyone. Thank you for joining us. We are going to be talking today about COVID-19 and the impact that it's having on our childcare community. So thank you for taking time to join us. Our agenda for today is to talk about the concern that we're having. So we will frame the concern, then we will be reviewing some guidelines, and then we will also be talking about how to communicate with families the information that you're hearing today. So who's on the call today is both family, friend, and neighbor, and family childcare home owners or assistants. So we would like to welcome all of you. Family, friend, and neighbor may be a term you're not familiar with. Childcare providers who are caring for their own and one other family's children are considered family, friend, and neighbor. So if you are someone who cares for your neighbor's children or for a relative or for a friend's children, you are not, there's no need to be licensed, or we consider that informal care, and it's called family, friend, and neighbor. If you care for more than one family's children other than your own, then there's a need to be licensed, and then you become a family child care licensed home. And so family child care providers who are doing care out of their home for more than one other family other than their own, they are considered family child care providers. So everybody, welcome today. So to frame this concern, we just wanted to make sure that we acknowledge that there is a rise in cases in Yolo County, and we have had some family child care homes that have had to close due to exposure to COVID-19. And so because that's happening, we want to make sure that you have as much information as possible. So why are we here and why you? Because you play a very important role in keeping the children in Yolo County safe and healthy. So one of the missions for First 5 YOLO is to keep the children in our community healthy and safe. And you are one of our partners in doing that. I want to play for you first a video that was created by Mary Ann Limbos. She is our health officer here in Yolo County.
Hello, I'm Dr. Mary Ann Limbos, the Yolo County Deputy Public Health Officer and a pediatrician. Illnesses like COVID-19 and the flu spread by droplets that come out of your nose and mouth when you talk. You don't see them, but they are there, and they can travel up to 6 feet away. If you shout or sing, these small drops can go even farther. If you're sick, people around you can come in contact with these drops when talking and can get sick too. Even people who are not showing symptoms can have and spread COVID-19. An important way to prevent spreading these drops to people around you is to use a face covering or a mask. You may have seen these masks when you go to a clinic or a hospital. You can wear a homemade cloth face covering or even a scarf or bandana. Just make sure it covers your mouth and your nose. Face coverings should be washed after each time you wear one. You would wash your face covering like you would your clothes. Put them in the washing machine or hand wash them and then let them dry. It may be a good idea to have a few face coverings available. Disposable face coverings should be thrown away after each use. Should children wear face coverings too? Babies and children under 2 years old should not wear masks. They can be dangerous for little ones because they can suffocate. But children 2 years old and older can wear face coverings, and you should encourage them to wear them. Talk to children about why you're asking them to wear a face covering. Tell them It is to protect people from germs. Another important way to prevent the spread of illness is to not go to work if you're sick. Make sure that you don't have a fever or other symptoms of illness like a cough or sore throat before you go to work. If you feel sick, call your supervisor and say that you're staying home because you're sick. If you feel sick during the day while you're at work, tell your supervisor immediately and go home. You should ask parents to keep their children home if they are sick. When parents arrive with their child, you should ask them if their child has a fever or any symptoms of illness before they are allowed inside. If a child becomes sick during the day, you should put them in a separate area away from the other children and call their parent immediately to come pick them up. This is a very difficult and stressful time for our community. It is natural to want to be with friends or family members who don't live with you. However, when you gather with other people who don't live with you, it increases the risk for people spreading COVID-19 infection. Please don't gather with other people outside of your household. There is no safe number for gatherings. This is something our community can do to stop the spread of COVID-19. We should not visit each other's houses. We should not be having parties or get-togethers. This will help protect our families, our neighbors, and our community. You play an important role in keeping our children safe and healthy. Thank you for doing this very important job in our community.
So thank you for listening. I think that she made some really important points, and we're going to talk more about some of that information. So our goals for this process is to use the information to create a plan for you to help protect the children who you are caring for. We really do want you to share this information with families, and we will talk about the steps that you can do to lessen, that you can take to lessen the spread of COVID-19. So we'll start with drop off and pick up. What we want to do is to minimize the contact between families during drop off and pick up. And so that tends to be a time when there are a lot of families all there at the same time. And so what we would like you to do is to stagger the drop off and pick up so that you assign times for families to drop off and pick up their children so that they can remain 6 feet apart. The wearing the mask is really important, and so you would be wearing a mask as well as the family. Whoever is dropping off and picking up the child will also have a mask at that time to be able to protect both you and the families. When you're dropping off, you want to make sure that you are screening the children. So many different programs have developed systems for taking temperature before the child enters the program. You also want to make sure that you and any other staff that you have are also taking temperatures every day. And so making sure that we're screening, asking questions about who they've been in contact with, if they've been around anyone who has been exposed to COVID-19, etc. So if you want more information on that screening tool, please let us know. So what we're looking for when we take the temperature is in a child, a temperature of 100.4 or higher. If you are tracking, logging the temperature every day, you'll find out who tends to run a higher temperature than normal, and then you are aware of when they actually have a high temperature. So we encourage that every day as the child enters the program, or if they start to show symptoms. So that documenting and tracking is really helpful helpful. And then that allows us to know if a child may be at risk, could possibly be coming down with COVID-19. And so we will be excluding children who have any cold type symptoms or any of the symptoms of COVID-19. And so, if a child were to be dropped off and in the morning they did not have a fever, but they begin to show symptoms of COVID 19, you would need to isolate them, as Marianne Libos was mentioning. So, that may be that you are able to put them in another room, or it may be that they just need to be put at least 6 feet away from all of the other children and adults in the program until they can be picked up. So we'll isolate the child, contact the family, and then we will be going over later when you need to contact public health. The other thing that we can be doing is cutting down on the amount of the number of materials that are shared by the children. And so keeping each child's belongings that come from their home in individual cubbies. You can see those in the back of this picture. Making sure that children have separate spaces for their lunch boxes, their coats, all of those things. We also encourage you to try to have children using their own toys as much as possible. So if you have, say, a set of Duplos or Magnetiles, you could put them in separate Ziploc bags so that the children can each have their own set to play with, so that we're cutting down on the number of shared toys that they're using. Other ways to do this is to make sure that, say you have Play-Doh or art materials, that again, you can have the child's own container with their own supplies so that they aren't touching each other's materials. And then, of course, we need to be disinfecting more than usual. So if children are using the same materials, like in this picture here, you would want to disinfect those toys before they're used again by any other children. Hand sanitizer is something that can be used, but most often we want to be washing hands rather than using hand sanitizer. Hand washing for 20 seconds or more is much more effective than hand sanitizer. If you are going to use hand sanitizer, it needs to have 60% ethanol alcohol base or higher. And we want to avoid methanol with an M. So methanol is actually poisonous and needs to be avoided. So most of those products, the hand sanitizers, have been recalled, but you may need to check and make sure that you don't have any that you're using. So children under 9 should not be using hand sanitizer, or should not have access to the hand sanitizer. So it needs to be kept up out of reach of children. So I mentioned that we're going to be needing to clean more often and also have better ventilation. So any frequently touched surfaces such as doorknobs, light switches, sink handles, the bathroom surfaces, tables, chairs, and the toys will all need to be cleaned at least daily. So those surfaces we will be using a bleach solution or an EPA approved cleaner to disinfect those, and it needs to stay on the surface of the toys or the tabletop, whatever you're disinfecting, for the length of time that's on the bottle. So they all have directions and you need to follow them in order to disinfect and kill the germs. So I think we've covered all that. So say there was a positive case. If there is a case, then the Yolo County Health Department will ask you to close your program and clean. And in cleaning, what we're doing is allowing the first waiting for 24 hours, allowing all of the particles to settle, all the droplets to be able to settle, and then we can clean all of the surfaces. And so we'll close off that area and not use it until it's been thoroughly disinfected. So the other thing that I mentioned was the ventilation. We definitely need ventilation when we're spraying the cleaners because we don't want children to be breathing in the fumes. But the other thing that we're finding is that it's very helpful to open windows in order to get airflow to to make sure that we don't have as many droplets in the air. And so if you can, before children arrive in the morning, open up the doors, open up the windows, air out the space where the children will be, there's much less likely to have the COVID-19 in the air. And also trying to be outside as much as possible. So the next slide talks about if we do have a positive case, we want to make sure to keep that confidential. If if a child in your program has been exposed, you can just notify the other families that a child has been exposed or a staff member, rather than identifying the person by name. So we want to do that just to make sure that we're being respectful of their privacy. And then that person needs to, anyone who has been exposed needs to stay home. So that exposure, if you believe that somebody has been exposed, they do need to stay home and they need to call public health and report what the exposure was. Yolo County is tracking cases, and we want to make sure that we are aware of who's being exposed in what situations and how long that they would need to be in isolation before returning. So you can also at that point call or send a letter to the families letting them know that the exposure has occurred. And then if you are a family childcare program, reporting that to licensing is an unusual incident report. So when a child or caregiver tests positive for COVID-19 and has exposed others in the child care, you need to consult with the local public health department and decide whether or not the program needs to be closed. Typically, the person who has been exposed has to isolate for 14 days. We'll talk more about this. When a child or caregiver tests positive or has exposed others, that we want to have that person isolated at home for at least 14 days after that close contact has occurred. If they have been away, it's been 10 days since they've been exposed, then they need to go 3 days without a fever and lessening symptoms. So this is that. So we advise sick caregiver or child not to return until they have met the CDC criteria, which is 3 days with no fever, their symptoms are improving, and that it has been at least 10 days since their symptoms first appeared or they were first exposed. So this information we would love for you to be sharing with families. So we've kind of broken it down to 4 main ideas, which are actually offered to you on some of the infographics, which we have been creating. And so you will be able to get those on this website as well. But basically the social distancing, the physical distancing of 6 feet from anyone who does not live with you. So as Marianne Limbos mentioned, it's anyone outside of your immediate household. So they may be relatives or loved ones, but they don't live with you. We would want to make sure that you socially distance from them. and then staying home as much as possible. You can, we need to go to the grocery store and we need to pick up prescriptions and things like that. But any other trips outside of the home should be limited. We only want to go out for essential needs. The other thing that Mary Ann Limbos mentioned was avoiding gatherings. So keeping our socializing to our immediate family and not with our extended family or relatives who live in other households or friends, that we need to avoid those gatherings. And then, of course, wearing a mask. Yolo County does have a mandate to wear masks when we're out in public. And so, anytime that you're around others outside of your household, you should be staying 6 feet away and wearing your mask. This is the 3 C's that we want to avoid. So this was originally developed in Japan and has been used in many communities. So the first thing to avoid is closed spaces with poor ventilation. So that's why we want to air out the programs every day, make sure that they're, we aren't just closing all the germs in by keeping the windows closed and keeping the program all closed up. So avoiding those closed spaces, avoiding crowded places. So the fewer, the better. We want to make sure that we don't have lots of people gathering together. As Marianne mentioned, there is no safe number. And then the last thing to avoid is close contact settings. So any place where we're going to be in close contact, which is why we're recommending that you stagger your drop-offs and pickups in order to avoid that close contact between families. We know that at this time, people are needing a lot more cleaning supplies. And so if you are in need of cleaning supplies, you can contact the Children's Home Society that's mentioned here, CHS. Children's Home Society is scheduling appointments for you to pick up supplies, including a touchless thermometer, other materials like hand sanitizer, bleach, other cleaning supplies. We want to make sure that you have what you need in order to avoid the spread for the children and families who you care for. So the phone number 530-645-6265 can be called between 9 a.m. and 3:30 p.m. on weekdays, or you can send an email for an appointment at referralsyo@chs-ca.org. These are the two infographics which I was referring to. You are welcome to give these to families to make sure that they're aware of the practices that you are implementing in order to keep the children safe. If you are a family, friend, and neighbor, and you would like to attend training, there is ongoing training through the sorry, I didn't change the name of this, through the Nurturing Parent Program. So Nancy Ledesma is in charge of those trainings, and you can contact her here at this phone number or at her email, nancy.ledesma@yolocounty.org. So please feel free to contact Nancy if you are a family, friend, or neighbor and are interested in ongoing training. If you are a family child care provider and you have a licensed family child care and you are interested in training, please contact me. My name is Lynn Arner, and my email is earlyyearsconsulting@gmail.com. Thank you very much for attending today. We appreciate you taking your time to be here and to work with us to make sure that Yolo County's children and families stay safe. Thank you for all the work that you do with children. You provide a very necessary need for our community by caring for these children. So thank you for keeping them safe and healthy.